This video is to complement the Your Journey Through Breast Cancer Surgery booklet. You should have received this booklet from your healthcare team. If you have not received a booklet, please contact your healthcare team. Exercise after breast cancer surgery is an important part of your treatment and recovery. Exercise can help you reduce joint stiffness, move your arm and shoulder more easily, strengthen muscles, and get back to normal daily activity. It's important to know what you were able to do before surgery, called your baseline movement, so you can track your recovery. To know your baseline, try these exercises before you have surgery. You should avoid vigorous exercise and sports in the early weeks after surgery, but it is important to stay active. Talk to your surgeon about how much activity is right for you now and when you can return to your previous exercise and sports. Work towards 30 minutes of activity most days. You may find that light housework is a helpful way to get gentle exercise. Ask your surgeon when you can lift more than 4.6 kilograms or 10 pounds. These exercises are for all types of breast surgery except breast reconstruction. If you have had breast reconstruction, speak to your surgeon about what exercises you should do. These exercises are for patients with or without a drain. These exercise instructions refer to your affected side, the same side of your body as your surgery, and your unaffected side, the side of the body that didn't have surgery. Do the exercises on both sides of the body if you've had surgery on both sides. If you have any concerns about how well you can move, your level of mobility, or strength, talk to a physiotherapist. Week 1. Start Week 1 exercises 24 hours after your surgery. Do these exercises until you have the same movements and range of motion that you had before surgery. If you have a drain, it's normal to notice more fluid in your drain after you do these exercises. Make sure your drain is well attached to your clothing and empty it before you begin the exercises. While you exercise, you may feel some pulling and stretching of your skin and surrounding tissue. It is not uncommon to have numbness, burning, or tingling around the incision or armpit area before you exercise. These sensations can exist during your exercise routine as well. If you have had a pre-existing shoulder injury or have sharp or pinching pain in your shoulder while performing any of these exercises, please stop the exercise and consult your healthcare team. If you're worried about your pain while you exercise or have any other questions, talk to your healthcare team. It's important that you take the time to go through and complete the movements of each exercise. Do each of these exercises 5 to 10 times, 2 to 3 times per day. Seated posture. Sit in a firm chair or on a stool with your back straight and your feet on the floor. Keep your chin tucked in and pull your shoulders back towards your spine. Tighten your stomach muscles by pulling your belly button in. Hold this position for 5 to 20 seconds, and then relax. Repeat 5 to 10 times. Active hand pump. Do this exercise while you're sitting with your hands on a pillow in your lap, or laying down on your unaffected side and supporting your affected arm on a pillow. Slowly open and close your hands as far as possible, and repeat 5 to 10 times. Shoulder shrugs and circles. Do this exercise either standing or sitting. Lift both of your shoulders up towards your ears, then circle them back and down. Return to the starting position and repeat 5 to 10 times. Assisted shoulder flexion. Do this exercise on your bed or on the floor. Lie on your back with your knees bent and both arms by your sides. Use the hand on your unaffected side to hold the wrist of your affected arm. With your affected elbow slightly bent, gradually raise your arms up towards the ceiling, and then if you can, over your head. Hold this position for 5 seconds and then relax. You may not be able to raise your arm all the way in the first few days. Return your arms to the starting position and repeat this exercise 5 to 10 times. Butterfly stretch. Do this exercise on your bed or on the floor. Lie on your back with your knees bent and clasp your hands together loosely behind your head. Point your elbows towards the ceiling. Slowly move your elbows apart and down to the floor. Hold this position for 5 seconds and then return to the starting position. Repeat this exercise 5 to 10 times. Shoulder abduction. This exercise is best started near the end of week 1 if you have had a pre-existing shoulder injury or have sharp or pinching pain in your shoulder while performing this exercise. Please stop this exercise and continue with the rest of the exercises. Sit in a chair with your affected side about 1/2 to 1 meter away from a wall. Keep your body straight and your shoulders level. Do not shrug your shoulders or lean to the other side. Place the fingertips of your affected hand on the wall, and with your fingers, climb up the wall slowly, as high as you can. Lower your hand back down by your side, and repeat 5 to 10 times. You can start week 2 exercises in week 1 once it's comfortable to do all of the week 1 exercises.